first one, HIV positive women have more gynec infection. So all the untreated vaginal infections can lead to serious illnesses and strain the immune system. There can be a lot of infections that can lead to less loosening the immunity, or also menstrual cycle problems, missed periods, lighter or heavier bleeding, or more severe premenstrual problems are common in people living with HIV/AIDS. Yeah. Hello, everybody. I'm Dr. Uday Kumar Jadhav from uh, Maharashtra. I'm an HIV physician working in the field of HIV from last 15 years. I have my website and hivclinic.co.in, and working 15 years in HIV was something to learn, to gain, and prosper. So today, working today's topic, we are going to see about women living with HIV. Women, as we know, is a part of the society which has been neglected and suffered a lot, and hence any kind of pandemic what we see, if we are not supporting or treating or diagnosing women, then we have a lot of issues that we need to suffer. So if you see that more than half of the people who are living with HIV worldwide are women. Women with on the age of 10 to 24 old are having a more risk of HIV than young men of the same age. Why HIV disproportionately affects women? Because there are unequal cultural, social, economic status in the society. And secondly, there is intimate partner violence, inequitable laws, harmful traditional practices, lack of access to healthcare services, education, poverty, and last but not the least, we have child marriages. And this particular kind of societal workup has made to suffer women a lot. Now, how differently HIV affects women? HIV, as you know, as a health problem, it's very unique to women. Number one, the ART medication that we are providing, there are a lot of side effects of the medication. Secondly, there are a lot of sexually transmitted infection that can happen, and most of the times, women cannot ask their partner or their husband to use one barrier contraceptive. Secondly, thirdly, they have gynecological problem as such them, and this can worsen as the age grows. Also, there is a lot of risk of cancer, especially cervical cancer, which goes undiagnosed. Secondly, women also have a lot of bone thinning and calcium metabolism issues. They also have mental issues which lead to depression. They can also, in the long run, can have lipodystrophy and diabetes. And last but not least, we have contraception and the pregnancy issues, which in turn affect the health of the women a lot. Now, first coming to general lipodystrophy and diabetes. As we know, diabetes has become a bigger problem of the whole world, and right now, a lot of people are going in the diabetic issues, and 20% of the people population has become diabetic in India itself. So HIV medicine, as no as such, can put weight in women and having a higher risk. As we know, dolutegravir, the drug, has given the issues of having a high weight gain, which leading to problems of diabetes, like that is increase the fat in the blood, there is cholesterol and triglyceride that we are concerned of, changes in the face, breast size, and body shape. Also, the risk of diabetes is increasing, and also the risk of heart problems, we know, is definitely on the rise. So, what can be done for the lipodystrophy? We have to review the HIV medications. Most of the time, people think that the medication that has been started has no early side effects, is a good medicine, but we have to be careful by using medication, as long-term side effects can give you a lot of other things that we can have to suffer. Then lack of exercise and also healthy, not having a healthy diet can also increase the problem. So taking healthy diet, exercise, reviewing the HIV medication, also stop and quit smoking, and also using cholesterol role drugs can help to fight lipodystrophy. What are the gynec problems that people can get? There are which are common in the women living with HIV. Now, the issues more common with them are the first one, HIV positive women have more gynec infection. So, all the untreated vaginal infections can lead to serious illnesses and strain the immune system. There can be a lot of infections that can lead to less loosening the immunity, or also menstrual cycle problems, missed periods, lighter or heavier bleeding, or more severe premenstrual problems are common in people living with HIV/AIDS. HIV positive women also should receive regular gynec care from doctor who is knowledgeable about gynec condition HIV positive women. Even HIV cancers are not uncommon in HIV positive women. What are the gynecological complications in HIV? Number one, there are frequent STDs that are there. These STDs can increase the rate of HIV, rate of STD also. Right now, we are seeing more of syphilis and gonorrhea in patients with HIV, and that can also be a newer regimen or newer pandemic that can cause due to patient with HIV. There are complications more common. There are treatment failure, which are also common, and the presentation may be of a typical or prolonged view. There are also commonest infection that is seen in HIV positive is of herpes simplex viper, herpes simplex virus, and this infection is recurrent. People try to change the doctor when they find that this particular type of infection has not been cured by the treatment. But we should know that this kind of infection can be more frequent and more recurrent, not due to about the virus, but about the HIV condition of the person. They can also have bacterial vaginosis due to tight clothing, due to unattended healthcare of the region. And also, right now, we are seeing a lot of syphilis in the patient. Syphilis, as we know, is a multi-systemic disorder which can have infection from one system to other. Even the neurological and cardiac diseases are also involved in syphilis, which are late presentation and can have more issues. There are also vaginal yeast infection, which are recurrent, and also HPV leading to cervical cancer is also not uncommon. Now, as we know, cancer, which is one of the most upcoming disease, now more diagnosed and more treated all over India, some cancers are increased with HIV infection. What are cancers that are increased? Women with HIV have a higher risk of cervical cancer. As we know, cervical cancer is the age-defining cancer illness, and lot of people who do not go screening due to stigma, and also pap smears are not performed. So, performing pap smears frequently in women with HIV should be mandatory, so that in the early stages, if you can find or diagnose cervical cancer, then we can treat them easily. Also, there are more skin cancers in HIV patients due to lack of use of sunblock or protective measures. So we need to also work with this, but because we are in a tropical country, also it's for breast cancer, similar to HIV non-infected people, and therefore we also should perform regular mammograms and understand the stage of the treatment. Also, HPV vaccine is recommended for children before before the age of 15 years, so that they can get the best of the treatment for protection from the HPV virus. Now, coming to the issue of HIV and sexuality. Women and men sometimes stop dating and have relationship after relationship after the HIV diagnosis. Why is that? Because people feel that when they have diagnosed with HIV, they cannot have a good marital life, or they cannot be active partners in the sexual activity. But as we know, this particular sexuality is a part of the life of human beings, and hence there is a lot of issues with the sexuality. The woman can feel depressed. They have the fear of talking about the HIV status is very common in India, and also vaginal infection can make sexual relationship more painful, and also with women with HIV and AIDS can still get pregnant. These particular issues can lead lot of tensions and turmoil in the life of woman, and there can be a lot of issues that could be worked up. Also, we have birth control, and birth control, we see that a lot of HIV women can safely use birth control pills, birth control issues, and prevent pregnancy. So what we have birth control pills, we have implants, we have properties. Also, this particular there are some medicines that may interact with them and then make them less effective. They are particularly the protease inhibitors, as we know, and some women may need additional form of birth control to prevent pregnancy. So what we should do, we should talk to the doctor and find out which is the best form of birth control for you. So talking to the doctor would help the person. Remember, Condoms are the only form of birth control that can prevent HIV transmission. HIV transmission cannot be prevented by other pills or implants, and also they protect against the sexual transmitted diseases such as gonorrhea and also syphilis. So condom is a topmost priority for women for having HIV. Now let's come to some questions about pregnancy and HIV. So a lady when comes to the clinic, she asks, "Can I have children?" Or will I get my partner infected if I am having HIV? What is the risk of HIV infection in my baby? And how long I will live? That's the major concern of a woman, that can she manage all the three things? But as we know, HIV can be definitely prevented to be transmitted to other generations by further kind of medications and treatment that we can use. We can prevent the risk of infection to the partner by some kind of medication given to the partner called as PrEP, and also they can live a long happy life, as we know people can live more than 100 years with HIV treatment in them. Secondly, they also affect that will my pregnancy impact my HIV, or does HIV affect my pregnancy? So the question that if they try to get pregnant, and then would the HIV affect more to them, or will that have some impact on the pregnancy? That we know we can be worked up. And also, when is HIV transmitted during the pregnancy? When the baby goes at the in the birth canal, what are the chances that the baby can get? Can I breastfeed? Do all women need heart? And what are the effects of heart on that is highly active antiretroviral therapy on my baby? So, as we know, women with HIV can have healthy pregnancies, may need to switch HIV medications, and the risk of transmitting HIV from mother to infant during pregnancy is 1 in 4, that is 25%. If she is not on treatment, if there is no treatment, then 4 out of 1 baby can be infected, 3 would not be infected. So, how we can work up and how we can reduce the risk to less than 1%? So we can do that by giving a prenatal HIV care for the woman. So whatever we do, whenever lady is pregnant, we see that she is tested for HIV, she is on treatment for HIV, and after she is on treatment on HIV, drugs selected should be such so that they do not affect the baby or the mother. Thirdly, we have to go for a C-section, cesarean section, if the virus load is more than 1,000. And lastly, there should be no breastfeeding, as still breastfeeding can have transmission of this. Now, there are two schools of thoughts in which the people below poverty line or people in the African countries, they say that breastfeeding can be done, but the risk of HIV is more than particular thing. So, in this particular picture, we can see that HIV transmission is in the utero is 8 to 10%. So, or in the HIV transmission intrapartum, it is 17 to 20%, and HIV transmission postpartum is 10 to 15% via breast milk in the baby pregnant. So, overall, if you consider that there is 35 to 40% chance, if you add to this, there is 35 to 40% chance of transmitting the HIV. But if you have proper treatment management, proper workup, then definitely we can control the HIV. It can be less than 1%, and in our clinic, we can say it is 0.001% if it is treated as per the latest knowledge of HIV management. The last important thing that we face is that the HIV and depression. Now, women with HIV, they can also have lot of depression. 60% of the women in HIV display signs of clinical depression, and most of the time, these signs of depression go undiagnosed. There are a lot of feelings of sadness, guilt, or low self-worth. There is irritability, lack of interest in activities. Also, there is a change in appetite or weight, aches and pains. And definitely, there is a lot of women who are difficult to make decisions or concentrate. Most of the time they feel guilty regarding that they did not do anything wrong. Why in the world they have contacted this disease? They try to blame their partner and not accepting the thought that yes, even if I have HIV, I can live a lot of happy life. There are a lot of thoughts of self-harm or suicide, changes in sleep patterns, sleep fatigue or loss of energy, and also low sex drive, leading to a more complicated situation and definitely a lot of issues. But Mind you, the depression is treatable. We can treat depression, and for that we have to refer a doctor to manage symptoms to a psychiatrist. A psychiatrist also is a taboo stigma in a country, and people think going to psychiatrist means that we have become some kind of mental issues that cannot be treated. But depression, most common, 60% in HIV positive women, should be treated with proper counseling and treatment. Next comes the issue of women's HIV and aging. Men and women with HIV live longer thanks to the effective treatment. As we know, that the treatment with HIV has become so simple. It is so cost effective. Diabetes is more complicated and more costly than HIV. So older HIV positive patients have more medical problems, but related to age, but they can be treatable. We have patients who are 95 years of age. We have couples who are 85 years of age. A lot of patients of mine are more than 69, 70 years of age and living a healthy life. People themselves are surprised. But as we know, women with HIV has to face health concerns as the age increases. So we have menopause. Early menopause also very common with more severe hot flashes and osteoporosis, a disease that causes bone to become weak and easy to break. So lot of people we can see can have orthopedic issues, and therefore we need to have the consent issue. The concern of older women, but especially for women with HIV and bone loss, occurs faster in women living with HIV, and some HIV medications can also increase the risk of osteoporosis. As we know, most of the diet in the Indian woman is vegetarian, where we receive less of calcium. As we are not opting for the non-vegetarian diet, definitely the calcium in Indian women is low. Secondly, Indian women go less in the sunlight, where vitamin D can be absorbed and we can have more calcium. But still, in India, we are not the women in India are not exposed to more of sunlight. Thirdly, older patients need different support and frequently afraid to share their problem. That's why it's important that women should come up and share the issues. So HIV medicine also has some side effects or drug interaction. Some HIV medication can cause different side effects in women. May put women higher risk of getting fat buildup throughout the bodies or having pancreas problem. They can also interact with other drugs which can harm you or make your HIV medicine less effective. And if you're taking HIV medications and have problems with side effects, please talk to your doctor. Talking to your doctor is the primary thing that will affect or understand. The doctor can understand you. An HIV doctor is more concerned with you than other doctors. So do not cut down or skip or stop taking HIV medication unless told by your HIV doctor. So that is very important in this particular issue. Living well, taking care of the whole woman, the benefits of good nutrition is always as clear. So well-nourished people have healthier immune system and better able to fight off infection. Most of the women in our country have kind of affection to the spirituality in which they think having kind of fast would help them to attain the spirituality. And this fast can increase, can be more in number in women who are afraid or having more of religious thoughts. Therefore, not having a well-nourished diet can weaken their immune system. Many HIV positive people are use food and supplements to manage complications and side effects, but this is not as such needed as if we have a balanced diet. Regular exercise can improve health and strengthen the immune system, and we need to recognize seek help for depression. That is the most thought in the segment. So we can have a psychological support group for women with HIV. HIV people feel helpless because they think there is no hope for the future. They feel that the life is very short and they can have lot of issues. The women in particular find themselves under suspicion, even when the stable partner has infected them and need extra emotional care and psychological support to cope up with it. So implication having a life-threatening disease as well as the potential stigma of a family and community members, an HIV-infected person cannot survive alone and needs help from family and friends. So supporting HIV-positive women would help them to attain a better health and have a lot of issues. To summarize this, HIV disproportionately affects women and adolescent girls because of vulnerabilities created by unequal cultural, social, and economic status. HIV can cause problems that are unique to women. Women with HIV can lead a healthy life, by having a regular medication and follow-up, healthy and balanced nutrition, regular exercise, regular screening for cancer and sexually transmitted diseases. Women with HIV can have healthy pregnancy. More needs to be done to reduce the gender inequality and violence that women and children at risk of HIV